Okay, let's bring in Julie Foucher. Julie, thank you so much for doing this today. How are you doing?
Thank you. I'm doing great, and I'm really excited to be here and talking to you guys.
Yeah, excited to have you. Always a pleasure to speak with you. I think the last time we actually talked to you was right when COVID was starting. So
Yeah.
much better circumstances now.
Oh, that's right. Wow, it's
Yeah.
been a while.
Yeah. But
We have got a lot to catch up on.
we do.
Yeah.
And I think first thing I wanted to ask you before we get into the precision care thing is that what has CrossFit Health, the entity that is CrossFit Health, been up to since Eric Roza took over?
That's a great question. So I think it's been a lot of ideation and brainstorming for a majority of this year. So I first met Eric. I didn't know him at all before he became CEO, but I first had an opportunity to meet him last July of 2020. And we just had a conversation about health, and we really hit it off, had very similar thoughts and ideas about what CrossFit Health might be. And then that led to a few different offsites, coming out to Boulder with a few different groups of people and really thinking about big picture. What could CrossFit Health be? What can CrossFit do in the healthcare space? And how can we better help our affiliates be that bridge from creating health, which they already do, to what any of their members' needs might be within the healthcare system.
Mhm.
So from there, there's a lot of, I think, different directions. We did a lot of focus groups with individuals who'd been involved in CrossFit Health early on. So a lot of the physicians who went through the MDL-1, or who had been involved in various ways, just to try to better understand how we can help them better serve their communities and their ideas. And then sort of a few different initiatives, which I think will be being announced over the next several months, but the first big one being this partnership with Wild Health called CrossFit Precision Care. And then, more things coming.
And can you expand upon the early kind of, I guess, MO of CrossFit Health even before Eric Roza took over? Because I feel like a lot of people were exposed to the concept of CrossFit Health without a ton of experience around like what the actual execution of CrossFit Health in those concepts were. And I know that there were the MDL ones and things like that, but anything that you can provide some insight for people who are maybe just not familiar with what the history was.
Absolutely. And I think it's confusing. I think most people who were even involved didn't really know exactly what it was.
Yeah.
And it's also confusing because the term is confusing. CrossFit Health, CrossFit itself is health. CrossFit itself does create health. It's what's happening in our affiliates all the time. So making this sort of separate delineation between CrossFit and CrossFit Health, I think is confusing also.
Mm-hmm.
But it started, I believe it was January of 2018, when Greg decided he really wanted to network doctors who did CrossFit, and he wanted to help train them to better understand CrossFit methodology so they could be better advocates in their own communities.
Mm-hmm.
And so that's why he decided to start doing the MDL ones. And what those were basically regular CrossFit level ones. It was just that they were all doctors in attendance. That's the only difference. So I think that a term gets thrown around a lot, or people are like, well, I want to do the MDL one, but no, it's really the same course that you get everywhere, every weekend.
Mm-hmm.
The only difference was there was all doctors in attendance. And I think it was great for the doctors to be able to network with other doctors and feel like they're not alone, because a lot of them, I think, work in their own communities and they work in the healthcare setting where it feels like everybody thinks they're the crazy one because they know that CrossFit works and that lifestyle works and it's more effective than most of what the things that we're doing in a healthcare system or hospital setting, but they don't have a lot of colleagues who also understand that. So I think that was very good for them. And a lot of sharing of ideas happened there that was really productive. I do think that it was somewhat isolating for other healthcare practitioners because we have so many healthcare practitioners in our CrossFit community who are doing amazing things in their, where they work with their affiliates. It's so amazing to hear about the things that they're doing. And in some ways they felt very excluded, which, they were, and that was Greg's intention, I think, just to start with doctors. But I think, moving forward, that's a big focus that we want to have with CrossFit Health, is including all healthcare practitioners. And then the other big initiative of CrossFit Health was really, the tagline was, it starts with the truth. It was about exposing a lot of the quote unquote ills of modern medicine. So bringing in speakers, scientists, physicians who were shedding light on some of the problems with our modern healthcare system and with science and research. And they would come in and give lectures. Basically, while the MDL one was happening, the level one was happening in one room, they would give lectures in the other room to returning members of that group. So doctors who had already done the level one, but they came back for these ongoing lectures. And then similarly, CrossFit Health did the CrossFit Health seminar, conference, which was adjacent to the games, usually a couple days before the games for the last few years, which was similar type of content, just bringing in experts to talk about some of the problems with our healthcare system. A lot of that content was then published online as CME content and CEU content through CrossFit Health. So that's pretty much what it was. And also obviously in relationship to that were some of the legal battles that Greg was fighting just to get special interests out of the health sciences.
How then has now Eric taken what that concept was, organized it, and then empowered the people within it to go forth and prosper?
Well, I think one of the things that was frustrating probably for a lot of people who were there at these events in the past was that there was a lot of passion, a lot of excitement, a lot of enthusiasm to do something. And in Greg's way, of course, he wasn't going to be the one to do it. He wanted us to figure it out and do it ourselves. Now, I'm going to maybe stereotype doctors a little bit to my own detriment, but we've gone through our whole lives and our whole training pretty much having steps laid out for us, like first go to med school, then take this test, then do residency, then get a job, fellowship, whatever. And so, I think as a whole, doctors probably do better with someone saying, hey, here's what you can do. And so our focus moving forward is not to squash, we still want to expose the truth. We still want to share best practices. We still want to have really tough conversations and get experts together and talk about things that still aren't very clear and try to get to the truth of the matter. But we also want to be able to provide resources, to be able to give healthcare practitioners, to empower them with things that they can do in their own community. And so that's in one avenue. CrossFit Precision Care does that. It basically allows a doctor or a coach or someone who wants to help as a care coordinator to apply for a full-time job and work with us. Or some of the other initiatives that are coming down the pipeline for CrossFit Health will allow all types of healthcare providers to share ideas, to have tools and resources to be able to really take what they're doing inside the affiliate and apply it or build that bridge to their practice in the healthcare system.
So I think that segues into the precision care and the announcement last week. And can you talk about some of the development process leading up to that? And for people that maybe aren't familiar, haven't watched the announcement video, you can go see that on YouTube, the kind of nuts and bolts of this plan.
Sure. So how it came about, I had these conversations with Eric around the same time. I really got to know this practice called Wild Health, which is started in Lexington, Kentucky, two emergency medicine physicians, and then also a CrossFit affiliate owner, Lincoln Brown, who co-founded the company. And it's really focused on what's called precision medicine, which is looking at each patient as an individual, looking at all of the different inputs that affect their health, and coming up with a personalized plan to help them maximize their health or improve their health. And so that means looking at inputs like their genomics, their environment, things that they're exposed to, what their unique goals are, the social situation that they're in, all different aspects, their family history, all different aspects, and creating a personalized plan. So I introduced Eric to the practice. He really was impressed with it and saw a lot of parallels between what we do in CrossFit. It's very data-driven. It's really focused on helping people optimize their health as much as possible. And so he really liked it. And that started conversations about how we could partner together and really take what Wild Health has already done, but really customize it and make it something unique to meet the needs of the CrossFit community. And so what that looks like is for CrossFit Precision Care is each patient comes in. Right now there's a wait list. So you go to care.crossfit.com, you sign up to be on the wait list. Towards the end of this month, we'll start accepting people off that wait list as patients. So they'll be able to go and sign up as a patient, choose a plan that's appropriate for their needs. And there's basically 3 different plans with various frequencies of visits with your doctor and your health coach. Then there's a whole bunch of testing to complete. So lots of questionnaires. We want to know everything about your lifestyle, about your family history, your medical history, your goals, your performance, all kinds of stuff. We'll also have an extensive lab panel for you to do, which you would get done at a local lab, like a LabCorp or a Quest. And then we'll send a DNA kit to your house. You'll submit a saliva sample, mail that back in. And then after, while you're doing all of that, you'll meet with your health coach. So you'll be paired with a doctor and a health coach, both who do CrossFit. You'll do an initial intake call with your health coach, just kind of getting to know them, for them to understand what your goals are, clarify any information from those questionnaires. And then when all the data is back, you sit down for a really in-depth initial meeting with both your doctor and your health coach. And that's where we go through all this data and we really put together a plan that's going to be most impactful for helping you get closer to your personal goals. And that's where I think the magic of Wild Health really shines, is they have invested a lot of resources into creating an algorithm that takes all these inputs and helps create personalized recommendations. And so that visit, instead of, the doctor sorting through all this information, when Matt and Mike first started doing this, it took them maybe 10 hours to sort through, a patient's DNA and their labs and put all this information together and make sense of it. Now that time can really be spent with the patient and getting to know them as a person, and then figuring out how do we apply all of this information, all of this data to them in a meaningful way that's actually going to be relevant to their goals. Because if, what may be like our goal for the patient based on just their medical information may not align with what their goals are. And generally their goals are going to be most important unless there's something, dangerous happening.
Yeah.
So that's what happens in that initial meeting.
When I first saw this, because I guess this is where I am in my life, the first thing I thought is, I wonder if my insurance will cover this. How or have you addressed that? Yeah, because I can't imagine that is a simple thing to solve.
It's not a simple thing to solve right now, except for if you just don't go through insurance. So it's using a model that's called direct primary care, which is actually becoming very widespread. It's being adopted by a lot of primary care doctors, which it just means that the doctor and the patient have a direct relationship, both obviously the relationship, and you're able to spend more time and get to know them, but also a financial relationship. So there's no third party insurance involved. The patient pays a regular membership fee to be part of the primary care practice. And while that can be daunting, I think, when people first hear about it, or it doesn't make sense, like, well, I'm paying for insurance, why would I pay extra money for this primary care? When you actually dig into it and look at how much money you're spending on insurance and spending out of pocket, paying against your deductible, oftentimes people can create a situation where they save money overall as a member of a direct primary care practice, because when you're paying out of pocket for that primary care, you can then sometimes go to a higher deductible insurance plan and save more per month on your premiums. And also, for a lot of things in medicine, they're much cheaper when you pay cash for them, as opposed to billing your insurance and paying down your deductible, things like labs and tests and things like that. It's very complicated, but it's the system that's working right now. From my perspective, it's a system that's working the best and has everyone's incentives aligned the best that I've seen. I don't know if it's a long-term solution. I think that hopefully over time we'll see, I think already insurance companies, employers, even a lot of like government employers are looking at this model because it can save money overall in healthcare. So I think we'll continue to see the models evolving.
And so obviously this is the early stages. It's only been announced a week, but is there anything that you can share as far as looking forward into what you're hoping to continue to roll out with this, on top of things like, like you mentioned, I just learned the difference around like paying cash and things like that, to hopefully maybe expand and make that solution a little bit more simplified?
I don't know if I can necessarily speak to that from like a cash insurance model. We're always looking at how we can incorporate insurance. So we're even doing tests right now with small groups within Wild Health of how we can incorporate insurance and make it more affordable for people. But from a large scale perspective, I don't know if that's anything I can promise in the near term. Yeah.
For sure.
What do you think the main differences are? And this might be self-evident, but between what is now sort of the traditional model of, I have a primary care physician and I go into an office and I visit that person if I have something I need to talk about.
Mm-hmm.
And now this new sort of evolving, not in person model that that precision care seems to be modeled after, if that makes sense.
Yeah, there's a lot of differences. I think for one, this model, this precision care model and telemedicine model is definitely more proactive and preventative. So say you go into your regular primary care office for, quote unquote annual physical or a regular checkup or preventive visit. Most of the time, if you're doing CrossFit and you're pretty healthy, there's not a whole lot they're going to be able to offer you. They're going to make sure you're up to date on your screening tests. There's probably not even going to be a lot of recommended lab testing, depending on your age. Maybe they might check, your insulin resistance or something like that. They'll check your blood pressure. But beyond that, they're going to say, keep doing what you're doing. You're working out, you're eating well, make sure you're getting enough sleep. Like, great job. And so I think for a lot of people, or worst case scenario, they'll say, you're doing CrossFit, that's so dangerous, you should stop. But I think for a lot of people, it's a big hassle because you have to take off work, or, it takes a long time to drive there, to wait in the waiting room, to do the whole thing just for a few minutes with your doctor. And oftentimes you don't really get a lot of time to actually talk to them or develop a relationship with them. Versus with this model, telemedicine obviously is very convenient. You can do it from anywhere. You don't have to wait in line. You can get pretty quick access for an appointment. But we're just doing a much more deep dive, in-depth look at your health. So we're looking at a very extensive lab panel, your genomics. We look at any kind of wearable data you're using. If you're using, a Whoop or an Oura Ring or an Apple Watch, we want to look at that data, any sleep trackers. If you're wearing a continuous glucose monitor, we're going to look at that. We're going to look at your performance scores. So we want to take all that information into account and look at the big picture, and also work with any other, anything else that you're doing. So maybe you also work with a chiropractor or a physical therapist or a dietitian. We want to sort of be someone who can look at the overall big picture of your health and make sure you have the right pieces in place, and make sure that we're kind of looking out for all of the things. Also doing the things you would get at a primary care office, like making sure you're up to date on screening tests and things like that too.
What are some of the obstacles that you foresee with getting this to a bigger rollout? Because I hear you talk about that, and initially it seems like a pretty daunting task from the individual side. But is that really the case? And there are some things that you've seen already that have possibly presented themselves as a significant obstacle?
I think just to rolling it out more widely, I think our biggest obstacle is just how quickly we can hire doctors, health coaches, and care coordinators, how quickly we can expand our team and train our team. I think it's different than any other type of offering, like, for example, CAP that just rolled out. Eventually, eventually it's something that's easily scalable. You don't need a one practitioner per gym or per person who's using it. So I think that's the biggest obstacle that we have in rolling it out. And with that, just obstacles with licensing and different laws in different states. And that's why our launch is only our beta test that we're launching at the end of October is only in 8 states to start. Really, it's due to physician licensing, but starting next year, we will have access to all 50 states. So I would say those are obstacles in being able to get it out to more people quickly.
And along those lines, and this is one thing I said back when CrossFit Health was first created, is that we do a very good job of talking to our own, but it's very tough to get outside that bubble and get to the people that could really benefit from something like this.
Yeah.
How do you get outside the bubble now and make people who have never been into a CrossFit gym, the ones who are on the couch and on the carbs, how do you get them into these programs?
Yeah, I'm glad you brought that up, because that's one thing that I'm really excited about with this. Is I think it is an opportunity to reach some of those people. I think probably the easiest way at first is through friends and family. So say you do CrossFit and you won't shut up about it. Your friends and family are not quite ready to set foot in an affiliate. Maybe they're looking for really good medical care, and maybe this is their entry point. So maybe they join as a patient, and then through that, they maybe start doing some exercise at home, and maybe eventually they gain the confidence to walk into an affiliate and start doing CrossFit. That's my hope. And we're certainly not, we are built around the CrossFit community, but we are not exclusive to people who are doing CrossFit actively. So our hope is that we bring more people into our community.
Is there a possible tie-in with the affiliates as far as, you know, prescriptive care? Because I've seen more and more, and maybe it's just the media that has been published of, you know, doctors prescribing CrossFit, or, you know, organizations that have kind of helped tie in healthcare directly in terms of putting CrossFit on the docket for what, you know, patients need to do.
Yeah, I think especially with probably some of the other initiatives we're doing with CrossFit Health, I think that's a big focus. And how can we make it easier for doctors to prescribe CrossFit? How can we make it something that's top of mind, that's not intimidating for the patient, and that helps them to be able to learn more about it and work their way into an affiliate? That's something that we want to work on, because we have so many healthcare practitioners all over the world. And if they can reach some of their patients in a way that's reasonable, then, you know, those are the people who probably can benefit most from CrossFit.
Diet and exercise just seems like such a no-brainer when it comes to someone's health. But when you go into a more mainstream health model and you go into a doctor's office and you talk things over, that's rarely brought up, if at all. Why do you think the mainstream, and maybe that's not the right term, but for lack of a better term, mainstream medical community doesn't lean into that as much as the CrossFit side does?
Yeah, I think there's a few reasons. I think it's complicated, but for one, it's not really taught in medical school. I think that there's definite improvements happening. Even since I've left my medical school, I know they've revamped their nutrition curriculum and are doing a lot of really cool things. But there's been very little emphasis on nutrition or exercise in medical schools. And then the second fact is really just how the healthcare system is designed and the limitations that are put on by the insurance model. So because with the insurance model, just speaking specifically about primary care, you know, each doctor or practice is reimbursed based on how many patients they see per day. And so in order for them to keep their doors open, they have to see a significant number of patients, usually 20 to 30 patients a day, which means they don't get to spend a lot of time with each patient. And that means that conversations that take a little more time, like nutrition and exercise, are probably not going to happen, or are going to be less emphasized. And even if it is mentioned, let's say you mentioned nutrition and exercise, you have a few minute conversation about it, the chances of a patient actually putting that into practice from one couple minute conversation is probably pretty small, if they're not going to see their doctor again for months or even a year. So that's one thing that was really obvious to me as I learned more about the system and I was in med school, was just seeing how poorly the system is set up to help people with behavior change and help people actually change their lifestyle in a way that serves their health. So that's part of it. And we've actually seen over the years, as appointment times have gone down, the amount of prescription medications that are prescribed has gone up. And I don't think that it's intentional. I think that it's one of these things that happens based on the constraints that people are in. And I think a lot of doctors, even if they have the best intentions, realize they've seen over and over again that this system doesn't work and people don't change their behaviors based on their recommendations. So they're probably quicker to prescribe medications than they would have been otherwise. And so that's sort of this cycle that we're in.
And you mentioned like the education aspect. And I know that was one of the few things that we saw quite a bit of on CrossFit's end, as far as like the MDL1s and the lectures and things like that. What things are being done now from CrossFit's end and CrossFit Health to kind of continue that and carry that education piece forward?
Well, there are more things coming out very soon along those lines, where we'll continue opportunities for continuing education for healthcare providers and CEUs for trainers. One thing that I'm really excited about that's part of what I'm involved in is just doing these weekly health tips. So those are coming out now on CrossFit.com, just really quick, actionable health tips with experts from our community. And then I'll be doing once a month a longer form live webinar with some great experts from around the world on various health topics. So that's just something I'm personally involved in, but CrossFit Health as a whole has a lot more coming in that department.
You mentioned when you were doing the MDL1s that doctors sometimes felt isolated. other than that, what are the biggest challenges that doctors who are in the CrossFit community who are trying to bring that methodology and the ideologies that are professed by proponents of CrossFit into their practices?
Yeah, I think it's kind of what I had referred to before. It's if they're in an insurance model, it's that there's not a lot of time to do it. So, I mean, I think people are being really creative. So, for example, there's a doctor who went through the MDL-1. His name is Jeffrey Meyer. He's over on the East Coast, I believe. And he basically created a program where he invited his patients to come to the local affiliate, and they're doing an experiment where they do CrossFit for, I can't remember how many weeks, certain number of weeks, and they do blood work before and afterwards, and they're seeing some great results. And so I think people are, a lot of doctors are getting creative about how they're partnering with their local affiliate or how they're referring patients to their affiliate. Like Rhonda Rocket was a great example. Was a family doctor, and before she stepped away from practicing medicine and went exclusively to coaching CrossFit, she would not only recommend that her patient, like, give them the name of the local affiliate and tell them, hey, you should go or you should call. She would actually ask them if it was okay if she gave the coach their number, so that the coach would actually call them and follow up. And they were much more likely then to actually follow up and go check out the affiliate. So little things like that people are doing that are making it, that are allowing it to be possible. But I think in the insurance system, it's hard to, in that 15-minute office visit in a doctor's office, there's not a lot you can do.
Do you feel like the tide is starting to turn a bit? It seems like telehealth is becoming, well, especially with the pandemic, telehealth is becoming such a bigger part, almost a necessity in this day and age. And it seems like I'm hearing more and more about it. And granted, we do kind of live in a CrossFit echo chamber at times,
right?
but from the medical community, do you feel like that's starting to turn a little bit?
I do. And I do agree with that. Sometimes I forget that we live in this echo chamber world, and then I get exposed to the real world again, and it's eye-opening. But I think the tides are turning, and one of the things that's most encouraging to me too is this next generation of medical students, residents who are going to become doctors. I think that this generation is learning this stuff. They're not learning it, maybe they're not learning it in med school, but they're learning it on their own for their own health, through podcasts, through doing CrossFit themselves. And I think that is what's going to help create a lot of change in the system. And then things like this, I think there are so many innovative companies that are doing things in healthcare, just to get, because patients are fed up with the system, doctors are fed up with the system. Nobody's really happy with it. I mean, the net promoter score for primary care is -1 point something. It's really poor. And I think it's almost 50% of primary care doctors that are burnt out. So nobody really likes the system. There's a lot of innovative things happening outside of the system. And then I think time will tell how that shakes out. Do we shift primary care so that it's almost outside of our healthcare system, and healthcare is just there when we have emergencies and we're sick? Or do we somehow bring it back in a way that's more productive once we prove it outside the system?
Do you think that's a generational thing? You talk about the next batch of medical students. It seems like exercise as a hobby or as like a pursuit outside of a career seems much more prevalent nowadays. I think I think about to my parents and grandparents' generations and their views on exercise in general. Is that one of the reasons why do you feel like there's just like the natural curiosity and propensity towards exercise?
I think there is. I think that even though some of the stats on, our life expectancy and chronic disease in our country aren't great, I think that, especially in the younger generation, I think we're seeing trends towards healthier behaviors. And I don't have numbers on it, but you can even see just based on different companies that are coming out, or food companies, even food companies that traditionally have had very, processed food that was very unhealthy, now are trying to come out with healthier solutions, because that's what people are demanding. We're seeing more healthy options for food. We're seeing more, more opportunities for exercise, whether it's being encouraged in workplaces or different fitness programs. So I just think in general, I think people are understanding the importance of that. And I do think it's generational. It's just my subjective opinion. I don't have any stats on it.
Yeah. How do you measure success in the early stages of precision care?
Well, I think right now success for us is just the feedback we're hearing from the community. So we're starting a beta, which is very much focused on how much feedback we can get and how much we can learn and adapt what we're doing. We're starting with what we think is the community's needs based on what we've heard so far, but we don't know until we really test it. So I think for us, just the more feedback, honest feedback that we can get from people, the better. That to me is a win. And then just the interest. I think if we see a lot of people signing up for the wait list, if we see people signing up for the care as patients, if we see people applying for jobs to work with us as doctors and health coaches and care coordinators, then we know that the demand is there and we can continue to try to meet that demand and just make it better.
And how has the response been so far? Is the wait list starting to grow? It's obviously very early on, but I'm just curious what the initial response has been.
It's been great. It's been, I think, surpassed our expectations of what we thought would happen within the first week or so. So I think we're all really encouraged by it, and it definitely seems like the demand is there. We'll see, when we start accepting patients, how many people actually are ready to sign up, but the initial interest seems to be really positive.
I just forgot what I was going to ask. I'm drawing a blank here. Man, I had a good question too. Yeah, total blank. Oh yeah, I know what I wanted to ask. What beyond the initiatives that you are going to be releasing soon? What's in the near future for CrossFit Health as an entity?
Yeah. Also, by the way, it makes me feel better that you sometimes lose your train of thought.
Oh, totally lost my train. I was like still listening to what you were saying, and I was thinking my question, and it just went.
I'm like, oh, Sean Woodland loses his train of thought, then it's probably okay for me to once in a while.
My cognitive abilities just took a quick break there for a second. Sorry.
That's great. So what do I see now? I'm forgetting what the question was. What do I see as the future for
just across CrossFit Health as an entity? Yeah.
Mm-hmm. Well, I think it's really focused. We are really focused around healthcare providers. So, making that distinction, CrossFit itself is about health. It's always been about health. And so, anything that CrossFit Health does is really focused on healthcare providers and healthcare. How can we better bridge the gap between what's happening in the affiliates and what's happening in the healthcare system and improve, the overall health of our population?
And speaking of that, the biggest marketing face that CrossFit has right now, I know this is probably going to change soon, but it is the games. And Greg's argument was that the games push people away from the affiliate because they get intimidated. First question, is that what you're finding, or did you when you try to talk to people outside the bubble? And if it's not, then how does CrossFit Health work with the sports side of it to increase interest?
Mm-hmm. Yeah, so I'm no marketing expert, but I do get the sense that that's true. I do think maybe it's shifting. And I think that's a continued focus is how do we highlight? I think the games is so aspirational and inspirational, and it truly does highlight, the pinnacle of what CrossFit is capable of. And I see for so many people that it has been really motivating and has been the reason why they start CrossFit. So I don't think that we want to lose that as a community, but I also do think that for many people, when they hear the word CrossFit, the first thing that they think is people, who look like these perfect specimens doing handstand push-ups and climbing ropes, and it's their first reaction is, wow, I could never do that. So how do we maintain that aspirational aspect of the games, but also be welcoming to anybody, no matter whether or not they've ever exercised before? And I forget the second part of your question, or if I even answered a question. But
that's
how do we work with the games?
Yeah, then with moving forward, how do you work with the games? I know you had some seminars at the games on site that were fantastic that you put out. How do you continue to do stuff like that?
Yeah, that was great. I think so. We did just a few panels. That was kind of one of the first things we did as CrossFit Health this year was just hosting some panels with experts on different topics at the games. And I didn't know how it would go because there's so much happening at the games and the focus is obviously on the competition, but I was really encouraged by how well attended they were live, and the enthusiasm that people had for them. And it just really helped highlight, I think, how many people are really invested in the improvement that CrossFit has, or the potential that CrossFit has to really improve people's health. And so I think continuing to do things like that. I think also, highlighting the fact that what we're doing with precision care can be applied to anybody across any stage of life. So whether it's somebody who hasn't even gained the courage to walk into an affiliate yet and they're facing multiple chronic diseases, or whether it's somebody competing at the games, just like CrossFit, we can meet you where you're at. And so I think that's something that we want to try to highlight as well.
And we were kind of briefly talking before this, that you'll be at, this is a little bit more personal, I guess, but that you'll be at Rogue. But do you see some benefit from you stepping back into the competition arena as a representative of CrossFit Health and being able to kind of showcase the fitness that you've built in that area?
I hope it will be a positive thing for CrossFit Health. I mean, I wouldn't say about showcasing the fitness because I definitely am the least fit I've been probably since the first couple of years I started CrossFit. But I think that's also kind of part of what's beautiful about CrossFit is that it's with you in any stage of life. And obviously where I was at when I was competing at the games was very different from where I'm at now, but CrossFit's still serving me and it's still helping me to have a great state of health. My performance numbers might not be as great as they once were, but my overall health is great. And I'm happy for sort of where I'm at in this stage of my life.
Yeah.
Why did you think that this was the right call? Be like, yeah, I want to get back out there on the and I'll put it in there.
Oh, well, I don't think you have a choice. When they invite you to the Legends competition, you can't say no.
Yeah,
no matter
legend,
how out of shape. I mean, even if I had worked out in 3 months, I probably still would have had to say yes.
Yeah, that's fair.
I don't know. No, I'm really excited. I think it'll be a lot of fun. And I'm just excited to see all the other women and men legends and see some familiar faces. So I think it'll be a lot of fun.
What's that been like for you, as a former athlete who's been on the podium at the games, tip of the spear, unbelievably fit, to go from that to now someone that I'm guessing you would just kind of consider yourself, I'm just sort of everyday CrossFitter. I go in and I do a workout when I can.
Yeah. It is different. I think for me, it's just been a lot. It's just about how you frame it. I think for a lot of people, this is a tough thing going from taking CrossFit as a sport or as a more competitive outlet to something that is more of a just sort of a lifestyle and a way to support your health. I think that it can be hard not to put these high expectations on yourself or not to, feel bad when your numbers don't match up to where they once were. But for me, I've really focused on the habits more than the actual numbers. And I think, there's probably, I don't know if that's the best way. I think there's probably, I may be fitter now if I put more emphasis on the numbers. But for me and all the other stressors that I have in my life, I find it's healthier for me mentally to think about, okay, I'm going to try to get 5 workouts a week. And that's like having that consistency over time is really important. And I know if I go into an affiliate and I'm with a group, I'm going to push myself hard. Even if I don't feel motivated when I get there, I'm going to be in the workout. Someone's going to be next to me and I'm going to push myself harder than I would if I was in the garage. So I try to just stick to the consistency of doing the workouts, trying to get into an affiliate setting at least a couple times a week to have that more competitive environment, and then really not stress about the numbers. And sometimes you surprise yourself. Like we did Fran a couple weeks ago, and it's like, you never know what's going to happen when you walk in, but sometimes you really feel it. And I felt great and did way better on Fran than I ever thought I would. So you never know.
I'm curious, like how do you balance the, if there's any, techniques or things that you use to help balance that expectation versus like realistic goals? Because for all intents and purposes, a lot of the community that's been around has seen a significant part of your life's journey going from, an undergrad student to CrossFit Games athlete to, a podium at the CrossFit Games to now a healthcare professional and someone leading the charge for the health side of CrossFit. And I know there's that little bit of internal competition sometimes. Like if you're a competitor, it's hard to like ever completely dial that back. I'm just curious if there are any techniques that you've found successful in better managing that.
Yeah, that's such a great question. I think for me, so in the past year has been a huge mindset shift for me in general, because I think it was kind of coming out of that treadmill of school, competing, residency, like you can't really even come up for a breath of air because you're always just going. And finally being able to step back from that for a minute and breathe and realize, okay, what's actually most important to me? And realize that a lot of times the things that you stress out about actually don't matter, or you're not going to care about them a year from now. And, I know I myself would get so stressed out about stuff or spend so much time thinking about things that in the big picture are probably not worth that extra energy. And so I think for me, it was just like really honing in on what's most important for me. And for me, again, that was a lot of relationships, a lot of here's the type of person that I want to be in the world, and focusing more on that. So it's not so much on the outcomes of like, here's how much work I'm going to do in a day, or here's what my workout scores are going to be. It's like, here's the kind of person that I want to be. And am I actually doing that? Am I getting better? Am I improving these character traits about myself that I want to be improving? And then I think also for me, a big thing has just been my faith. Like, I think that being able to lean back on that and know that even if something isn't going right, it's okay, because I'm probably learning something from it. And trying to have that kind of that obstacle is the way mindset of, if I didn't do great in a workout, or if something happens at work that's, frustrating or made me look bad, thinking about, okay, this is actually something that's going to help me and I'm learning from it, as opposed to getting really upset about it.
Yeah.
This just popped into my head as you were talking about, being healthier and working out, not to compete. But one of I think the biggest obstacles that CrossFit has faced in getting outside the bubble is when you have high profile celebrities like Jillian Michaels, who goes on social media and posts about how she doesn't understand CrossFit and puts some stuff out there that just, is misguided at best and, not blatantly not true at worst. How do you push back against that? I guess, how would CrossFit Health push back against that in a way that would better educate people out there and maybe assuage some fears about people coming into a box?
Yeah, that's a great question. I do think that's a role that we can play. And I think, in part that is what influenced us to do the injury panel at the games. So, a lot of fear that people have around CrossFit being dangerous or creating injuries, it comes from, as a whole, I think in CrossFit, we can do better at this. It's all about how do we better communicate it? How do we help people understand the core methodology and the way to apply that methodology? How do we train our trainers to do that? But also just talking about some of the things that we do know about injuries. And if you actually look at the research that's out there, CrossFit is no different than any other sport, any other type of physical activity when it comes to injury rates. It's just been blown out of proportion in the media. So I think for us to be able to provide some of that hard evidence and be able to talk people through that, I think that's definitely a role we can play.
Yeah. I feel like in this social media discourse landscape that we're in, being able to have readily accessible data, and I feel like we're in the world of like a copy paste study, like in the comment sections, and that's one thing that I think, at least in the big picture, will be a quick way to dissuade the message boards of people and that are just naysayers.
Yeah, and I like I've said before, I think that someone should have invited Jillian to an L1 and done it very publicly. Be like, come on out. Well, you obviously don't know what you're talking about. We're happy to educate you. And then if she turns it down, then it's on her. Yeah. So
it's true. And I think there's truth to that too. Like, we can't get too caught up in what other people say. We just have to keep doing what we're doing. And the fact that it works, it's not like we could change these perceptions within a month or even a year. It's going to take a lot of time, but the more that we keep doing what we're doing and we do it really well and we help people get results, it's hard to ignore that.
For people who want to sign up for the wait list or want to learn more about precision care, what's the best way for them to go about doing that?
care.crossfit.com. It's pretty easy. You can find out everything there. You can sign up for the wait list. If you want to work with us, you can learn about jobs, FAQs, all the stuff.
Yeah. Well, awesome. Listen, thank you so much for taking the time to do this, Julie. And I am super excited to see you back out on again, the competition floor.
Thank you for using those air quotes.
Yeah, well, I know you're trying to temper expectations, but it's going to be great for a lot of people who, because I think the last time we saw you, it was with the old boot on the foot, right? I mean, that was it.
Well, I did do rogue.
You did do a team. That's right. Yeah. Yep.
Well, no, I did team. I did individual, and then I did team at regionals. But I did do the Rogue Legends in 2019.
Okay,
so
that's right.
That would have been the last time.
Okay. Yeah. All right. Well, that's going to be fun.
Yeah.
It's going to be a good time. That Legends competition is going to be a good time. And for
It'll
those
be
of you listening to this or watching this who have not, who aren't very steeped in the CrossFit history, check that competition out because you're going to learn a lot. So, Julie, what's coming up next for you? What do you have on the calendar here in the next couple of weeks?
I'm going to an affiliate gathering. They're doing these affiliate gatherings in the districts all around the US the last few weeks. I'm going to one in Southern California this weekend. And then I think I'm going to be in Denver next weekend for that affiliate gathering, and then Rogue after that.
Cool.
Sweet.
Well, thank you so much again for doing this. It's always a pleasure to talk to you. Best of luck with everything. And I will be going to care.crossfit.com to probably sign up for the wait list because this is really cool. I'm really interested in this.
Yeah, for sure.
Awesome. Thank you guys so much.